Sounds good. How does it actually work? Dr. Amanda Joy Calhoun is here tonight to help us. She's a resident at Yale School of Medicine for Adult and Child Psychiatry. Dr. Calhoun, you've worked in community behavioral health clinics, is my understanding. It's a new concept for a lot of us. I've heard the term. I couldn't tell you exactly what it is. The White House is putting big money behind it. Do they get better results than, let's say, traditional treatment?
Well, that's a really interesting question, because traditional treatment for many Americans may be no treatment when it comes to mental health. I work with kids as well as adults, and there are many children who will never see a mental health professional, even though they're struggling with a mental illness like depression or anxiety. So when you talk about comparing community mental health clinics or community behavioral health to standard treatment right now for many people in this country is nothing. And actually, even when you think broader to people who do have a lot of resources, meaning they might, have insurance, they might have the money to actually pay out of pocket for psychiatric services. The wait time in many states across the country to see a child psychiatrist like myself is 6 months, maybe more. And that's for one visit.
Which, the cost can be prohibitive. A lot of them, are private. And when your child might be thinking about suicide, 6 months, there is no 6 months. It's right now. Yeah. President Biden, he talked about this being cost effective. And I don't know if this is right. I'm envisioning one building, but it does psychiatry and then drug abuse and a bunch of different stuff. And I guess that does introduce an efficiency there. Are the services free? How does this all work?
Yeah, so, in a lot of community-based clinics, the services are free for the most part for the patients. And the way that I conceptualize this is, think about another chronic illness. So let's say a person has high blood pressure or diabetes, and they don't see their primary care physician. So they don't see their family physician. They don't get any treatment for it. And then eventually their blood pressure gets so high or their diabetes is so uncontrolled that they get really sick and they get admitted to the hospital. And that's a very expensive and devastating experience, because by then they're really sick. So I think about it similarly with mental health care. It's sort of like I said before, the standard of treatment for many people is nothing. So you're taking a person who might be severely depressed or potentially have psychosis and be homeless, and you're giving them community mental health treatment, outpatient mental health treatment, to hopefully keep them from getting so sick that they have to go into the hospital. And so in that way, we are, able to reduce the cost of mental health care. And so I do think that, and I'm very optimistic that, increasing the funding towards community-based mental health will really result in more cost effectiveness and more treatment for people who simply cannot get it and are not getting it.
And for doctors like yourself who want to help people, when other doctors are out there charging maybe $500 out of pocket to people, like people are wanting to step in and help, it's really a godsend to those people. Let me ask you, where is this most needed? Because I live in Washington, D.C. There are tons of specialists here. Are rural areas more in need? Where's the need?
I think that's a really great question. And I can't say where the need is greatest, to be honest. You would think, in rural areas, there'd be a lot of need, and there is for sure. But the sad part is there's a lot of need in cities and in urban areas as well. Because, like I said, the wait time might be, even if you have insurance, might be 6 months, for some people 9 months. And then if you think about people that have less money, less access to resources, the closest clinic for you might be a 45-minute drive. And if you don't have a car, that might be multiple buses. That might be, something that's just not feasible for you to bring yourself in or your child in if you're working until 5, 6 p.m. and you have to take multiple buses to get to the clinic. So the sad part is, even for people that live in urban areas and cities where there are a concentration of specialists, they can't get to us. And so, these community clinics are going to be important for rural areas as well as urban areas.
Dr. Calhoun, one more thing I wanted to ask you. If I'm out there and I'm thinking this is exactly what I needed. Now, I'm envisioning mile-long wait lists. If it is free, if it is available, I'm thinking there's only so many people who are certified to be a psychiatrist. But how would I go about finding the right services for me?
So, I think that it's really difficult. First of all, it's difficult to find mental health services right now if you have insurance and if you can pay out of pocket. Now you're talking about if you don't have insurance and you can't, or you do have insurance, but you can't afford, to pay out of pocket, it gets more and more difficult. So, there are websites that actually do have listings for mental health providers. Psychology Today has a really good website that I actually will use or refer patients to. But the tricky part is then you have to figure out, does that mental health professional take your insurance? Will that mental health professional, do they work in a community clinic? Are they going to require you to pay out of pocket and then have your insurance reimburse you later? So it's a headache. So I'd recommend, starting with someone online, looking them up, and then just calling and saying, here's what I have. I have insurance, or I don't have insurance, or I can pay out of pocket. Who's available?
I don't have,
but I think it's a headache.
Yeah. Yeah. Dr. Amanda Joy Calhoun, thank you so much for your time. And thank you for the work you're doing, by the way, too.
Thank you so much for having me. It was great to speak with you.
Still ahead tonight.